Aphorism 73 Organon of Medicine. As regards acute diseases, they are either of such a kind as attack human beings individually, the exciting cause being injurious influences to which they were particularly exposed, excess in food, or an insufficient supply of it, severe physical impressions, chills, overheatings, dissipation, strains, or physical irritations, mental emotions, and the like are exciting causes of such acute febrile affections. In reality, however, they are generally only a transient explosion of latent sora which spontaneously returns to its dormant state if the acute diseases were not of too violent a character and were soon quelled, or they are of such a kind as attack several persons at the same time here and there sporadically by means of meteoric or telluric influences and injurious agents, the susceptibility for being morbidly affected by which is possessed only a few persons at one time. Allied to these are those diseases in which many persons are attacked with very similar sufferings from the same cause. Epidemically, these diseases generally become infectious, contagious when they prevail among thickly congregated masses of human beings. Thence arise fevers, in each instance of a peculiar nature, and because the cases of disease have an identical origin, they set up in all those, they effect an identical morbid process, which, when left to itself, terminates in a moderate period of time in death or recovery. The calamities of war, inundations, and famine are not infrequently their exciting causes and producers. Sometimes they are peculiar acute miasm, which recur in the same manner, hence known by some traditional name, which either attack persons but once in a lifetime, as the smallpox, measles, whooping cough, the ancient, smooth, bright red scarlet fever of Sydenham, the mumps, or such as recur frequently in pretty much the same manner, the plague of the Levant, the yellow fever of the sea coast, the Asiatic cholera. Footnote 1. The homeopathic physician who does not entertain the foregone conclusions devised by the ordinary school, who have fixed upon a few names of such fevers, besides which mighty nature dare not produce any others, so as to admit of their treating these diseases according to some fixed method, does not acknowledge the names Goal fever, bilious fever, typhus fever, putrid fever, nervous fever, or mucus fever, but treats them each according to their several peculiarities. Footnote 2. Subsequently to the year 1801, a kind of purpura miliaris, rudewonk, which came from the west, was by physicians confounded with the scarlet fever, notwithstanding that they exhibited totally different symptoms, that the latter found its prophylactic and curative remedy in belladonna, the former in aconite, and that the former was generally merely sporadic, but the latter was invariably epidemic. Of late years, it seems as if the two occasionally joined to form an eruptive fever of a peculiar kind, for which neither the one nor yet the other remedy alone will be found to be exactly homeopathic.